afternoon, student pharmacists. Today we are presenting a case study regarding the advancement of universal health care in the United States. Our group consists of Kyle Bircher, Ryan McTish, and George Go. What is universal health care? Universal health care is health care extended to all citizens of a governmental region via a single-payer system. A single-payer system is defined as a government organization which would collect all health care fees and pay all health care costs. Now, if everyone would please get their clickers out, the quiz will be beginning shortly. Healthcare is one of the top 3 issues facing our generation today. Lack of healthcare or insufficient healthcare is the problem. Universal healthcare is a possible solution. However, there are both advantages and disadvantages to this solution. The problem is this. Look around. Approximately 1 of the 5 people sitting next to you would be uninsured, according to the general demographic of our country today. The current state of American healthcare is that although the United States spends the highest per capita of any nation on healthcare, our life expectancy is only 78 years. This ranks us 24th in the world, comparatively speaking. Our health-adjusted life expectancy, or HALE for short, is even more deplorable at 69 years and a world ranking of 31 comparatively. The world rankings not only reveal the problem with our current system, but the advantages of universal healthcare as well. As evidenced by the rankings of other peer-industrialized nations that have instituted a universal healthcare system, such as Japan, France, Canada, and the United Kingdom, due to the results of our current system, our government has considered universal healthcare before and done feasibility studies on the subject. A 1991 report by the U.S. General Accounting Office, in conjunction with the Congressional Budget Office, found that a single-payer system, similar to that of Canada's, would more than pay for itself due to reduced administrative costs as well as having universal access to healthcare, especially preventative healthcare. However, there are disadvantages as well. One of the main concerns is patient privacy. With universal healthcare, all of your medical information will be accessible by the government, resulting in a situation reminiscent of Big Brother. A universal healthcare system would also result in simplified administration. However, simplified administration through a single-payer system would result in a net loss of jobs. President Obama mentioned some of his doubts on this subject while on the campaign trail due to the large number of jobs in the health insurance industry. To quote the president, "Given that a lot of people work for insurance companies, a lot of people work for HMOs, you've got a whole system of institutions that have been set up." End quote. Although universal healthcare has not been instituted on a federal level, it has been instituted at a state level in the state of Massachusetts. As our only local example of universal healthcare enacted, the results of this situation do not bode well for the future of universal healthcare in our nation, as evidenced by the figures in the graph below. Based on our research in this matter, we believe that the United States has reached a pivotal point in the evolution of our healthcare system. The question remains, should the United States institute a universal healthcare system or not? Now, if everyone would please get their clickers out, we will be polling you again to determine if the class's opinion has changed. Now, we would like to close with a quote by Martin Luther King Jr., and I quote, "Of all the forms of inequality, injustice in healthcare is the most inhumane." End quote. We would like to thank Dr. Franich, Mr. Brinkley Warren, and Mr. Hajime Uchiyama and the Digital Media Lab at the Miller Learning Center for their assistance with our podcast production today. Thank you, everyone. This has been a public service announcement developed by Bircher, McTish, and Go Productions.